My name is Smith Shah. I'm one of the first-year residents in a Prisma Health Neurology department.
And I'm David Lockwood. I'm a second-year resident here at Prisma Health in Neurology.
The biggest reason why I chose Prisma Health was because of its academic focus, specifically on vascular and stroke. And not only that, in Prisma Health specifically, there's all other neurology subspecialties which have a huge focus, like movement disorders. You look at all patients like Parkinson's disease, PSP, etc. So you get to see a holistic approach for the field of neurology. And when I interviewed here, I felt that it was a very tight-knit group of residents that I will get a chance to work with. I feel like a small family.
The people really stood out. I immediately recognized how supportive they were, and it was just really easy to get along with them right off the bat, whether that's my co-residents and also my attending physicians as well. I could tell that they would be people who I could easily develop a relationship with and work side by side with.
My name is Jeff Myers. I am a second-year neurology resident.
My name is Cal. I'm a third-year neurology resident. So we're a small program, which I think is a good thing that carries a lot of advantages at the same time. We do get quite a bit of consults, so we get to see a lot of patients. We see quite a diverse group of pathology, which is really nice, so there's a lot to go around. And the other advantage too is because it's small, you really do get to know the faculty very much on a one-on-one basis. So not only do they become sort of mentors to you, but they actually do become friends, I'd say.
Everyone gets along really well with each other. There's great communication, with each other, a lot of interaction outside of the day-to-day life in a social setting, people hanging out with each other, going out to eat or going out in the evening. There's a lot of collegiality. We work really well together.
I'm Nishant Kodumuri. I'm a PGY5 Neurology Fellow for Vascular Neurology here. I was a chief resident in the program. The very important thing I like about this program is the autonomy, and mentoring in this program is great. Having very approachable faculty, also being able to do more of a research.
My name is Suvik Sen. I'm the chair of neurology and a professor. I would point out that this is a comprehensive stroke center. It's a comprehensive epilepsy center. It's also a Huntington disease center of excellence. And recently, it's a Parkinson's disease center as well. We see a lot of variety of patients. So a resident in the training would get to see the whole variety with the proper faculty to help and guide the treatment for those conditions. The other part is that this is a very good place for clinical research. So residents are involved with clinical research very early, and they have options of engaging in stroke research, which we are doing, or some of the other research in epilepsy, Huntington disease, you name it. So we are very critically located here. We are called as the buckle of the stroke belt, very high stroke death rate. So for us, we are a comprehensive stroke center, which means 100-mile radius. All the complex and simple strokes come here. We have a stroke unit. We also have a neurointensive care unit.
I'm Dr. Venkatash, and I'm the program director for the Neurology Residency program. I'm also the program director for the Vascular Neurology Fellowship. The three things which I would say sets this program apart is the commitment of the faculty to teaching, the friendliness of the residents and the camaraderie, and then the fact that we have a great program coordinator, Rhonda, who goes all out to help you achieve your ends. I would say 80% of my graduates have gone into fellowships, and they've gone into fellowships at places they wanted to go, and 20% of our graduates have gone into practice.
So we emphasize a lot on work-life balance, and one of the key things is I do mention to the residents that whenever they get time off, go somewhere, do something fun, relax, do not keep that time all in studying. And we're kind of located very nicely in the center of the state with very easy access to the ocean as well as the Blue Ridge Mountains. Both of them are easy driving distance. Having life outside work is so important. Residency can be stressful at times, and it is so important to recognize that and make sure everybody's taken care of.
To conclude, I think this is a well-balanced program and very friendly atmosphere and very good clinical exposure. It's a blend of everything. So this is what I think every training program needs. And I feel very confident graduating from this program, very confident in practicing on my own, may it be an outpatient setting, inpatient setting, or any subspecialty practice.